Hey everybody, this is CT and it is 5:09. I wanted to talk about um, an experience that I had back in 2016. Um, and that and the thing is, like, I just wanted to, to just basically talk about it because it was on my mind, and I mean, sometimes it's kind of hard to get over, and yeah, not many people know this about what happened, but I'm a cancer survivor. I have been for quite some time. And basically, this is around the month that it happened. This month in 2016, April 2016, that I had surgery. I had lung cancer surgery. Um, so, I mean, it was around 2015, around Thanksgiving Day. I was going by, I went by some family of mine, mostly like on my mother's side, and well, was supposed to go by one of my god brothers, my eldest god brother, and but the thing is, like, it took like I don't know. We went, instead of that, we went to see, my mother's family, like her side of the family. And anyways, around that time, and I mean, we spent hours there. It was fun. It was all good. But around that time, it was like, I don't know. I felt something, in me. Like, I don't know. I didn't feel right. And when so I don't know. I was having like I don't know. My blood pressure was was high, and I was like feeling a little dizzy, and you know. I just I was kind of like out of it. And I was having like a fever at the time, and what else happened? I had, well, I mean, I kept talking about it. I just but like, I wanted to go to the hospital so bad. I kept on saying it over and over again. But nobody didn't even budge to take me to the hospital, and so I could get checked out or something. So what else could I have done? So I mean, I don't know. Like, eventually I took a little nap, and then I was like feeling, after I woke up, I was feeling a little bit better. Fever and everything, fever, blood pressure, it was subsiding. It was crazy. So I don't know. Like, I believe that was around the start of it, because come January, like, I started to get the flu, and I mean, I'm really strict on health. I know, I know about health very much, and I take that very seriously. Anyways, so I was home around that time, so I didn't, it was only for that one day that, around Thanksgiving, that was by family and everything, and but that was just it. So anyways, I was at home, and then I went, I was feel yeah, again, I was feeling this thing come over me, and I was like coughing. And the thing is, like, that was like throughout the months, like from Thanksgiving Day of 2015. After that, I just kept coughing. I just kept on coughing and coughing, and it wouldn't stop. I was having like dry coughs, and it just wouldn't stop. And it was so I couldn't control it. I couldn't do anything. Of course, I was in this game, and what happened was that I was talking to my league mates and everything. I mean, we all like communicated around that time, a lot, but yeah, it was pretty crazy. And then the next thing you know, I I basically like my league mates, they just noticed that thing about me, like like, what's up, I'm like, dude, I have the flu, I'm having the flu. And the thing is, like, I used to spend a lot of time in this game, in DCUO. I used to spend a lot of time, and X amount of time, just making progress by getting feats and all that stuff. And then these guys was like, telling me to go see a doctor, just go see a doctor, go, and then I and then I just didn't know what to do, and everything. I was like, I want to go see a doctor. I think I should, but the thing is, like, I was losing a lot of strength that time. In January, around January 2016, I was losing a lot of strength. So I don't know. I just couldn't do it. I was, the fever. I was having a fever, and it was getting real worse. I was burning up, and I'm prone to pneumonia. And yeah, I'm prone to that. I'm prone to getting that. I mean, I have epilepsy and stuff, but and didn't know like what to do. I didn't, I was like, my body was like so cold, and my head was so hot, and I was like, I don't know, I was in a bad spot, and ever since then, like I was telling my parents, my mother and stuff. I was telling them, like, come on, let me go to the hospital. Let me. So I think something is definitely wrong. Something, and I totally sensed it, because I was feeling something, and I don't normally feel like that. And it took her like about a few months. Now, if I wasn't feeling like that, and I was feeling a little something and stuff, like if I had the strength, because I didn't even go anywhere. I was like at home all day, and I just couldn't do anything. I mean, if I was out, if I was out like at work or something like that, I don't think I would have been able to make it to work or anything like that, because it was really, really bad. And so sometime, like, so yeah, but I was taking antibiotics, since it was like saying, okay, it was just a flu. But the thing is, like, going on from that point, in February 2016, it was kind of like gone, but it was still lingering and stuff. And And then, yeah, this thing happened, and um, I just started. I was like, wait, why am I still coughing? Something's going on. And yeah, so, but then because I was still feeling weak. I was still, so I don't know if that was like, like if it had anything to do with the side effects. Like if I was like recuperating from the flu that I had, and yeah, I don't know, but what happened after that? So like I was like, you know what? I literally had to like put my foot down sometime in March, and then yeah, it was just insane, it was really really insane about how I was feeling, because I don't really normally feel like that. I know how I feel and everything. But anyways, going from that point on was I just felt pretty like real sick and stuff, and I was like, look, let's go to the ER. Take me to the ER right now, because something is definitely wrong and stuff. And I was like real sick and tired of it, and I had to been like real argumentative and all that, so it was like, okay. So we went to the hospital, and apparently they were doing these tests, and all of a sudden I was admitted into the ER. I was admitted into a room that that I had a pulmonologist come have a look at me, and it wasn't like, it wasn't like that I had, it wasn't like that I had this thing going with me, it's just they do a little test, whatever, and then after that they send you home. No, it wasn't like that. And so I got a room. I didn't know how serious it was. I just didn't know. But all I heard from the pulmonologist, he just didn't give up from me, and all I heard was that I had to get something. It was like the amount of tests, because something about my lungs, my lung was like, it was something about it was looking so cancerous, and that's what he was saying. But it wasn't like for sure yet until he made the call, until he was sure about that. So I was in the hospital for quite a few days. My league mates didn't really see me on, and then all of a sudden, I mean, I didn't really want nobody to know. I just didn't really want nobody to worry about me like that, or whatever, but I mean, the word started getting out, and so it was like, my mother told my father that, and all this crap, and then he started telling, he started boasting about it, and then I don't know, I think my mother was doing the same thing, and I was like, look, I can't, I'm not appreciating this very much, I wasn't liking this sort of thing, and I didn't want it to make it into a big deal. I didn't go for surgery yet, but I was going from this room to go to these other rooms, getting all these other tests done, and then I can't remember exactly the name since it's been too long, but but it was something like, I think it was a biopsy or something or whatever. So they had to do that with my neck or something, and they started using all these words and stuff that really confused the crap out of me. And yeah, so I just happened to kind of like be back and forth. And then then the next thing you know, I had to go to this other hospital, right? That was like maybe like a mile or two away or something, or maybe like 5 miles away. I don't know exactly, and then I don't know what they were doing. They just did something, I mean, I always had to like wear those hospital gowns and everything. And this other place was pretty scary because the way how it was, because it sort of looked abandoned in a way, but next thing you know, it was like it literally had a place where people just had this surgery. Now I don't know, yeah, it looked like one of those type of places where where they just handle these things, and they're more advanced, or they mostly specialize in whatever. So I didn't know exactly. Yeah, so the amount of things. So I don't know what happened, but I was out. I kind of woke up a little bit, and then so, and then I went to sleep. I went to sleep, and I was out for for basically the whole day, and I found myself back in the hospital, and yeah, so yeah, they were doing something like inside my inside my throat, and then they were like poking, I don't know, they were like poking needles or something on my neck and stuff and everything like that. So they were doing those type of things. And yeah, the pulmonologist came, and it was all like, yep, I have lung cancer. I was diagnosed with lung cancer, and I just didn't know what to do about that. And I was a little shooken up, from that, because I never thought I'd get cancer and stuff. And then I was like, you know what? Let me just go ahead and do this thing. Let me just go ahead and, contact, any one of my league mates and stuff, so they could tell the rest of the league mates about, well, where I'm at, how I'm doing and stuff. And it was one of the guys that, I got into an argument with. When I had first posted had done a video and everything. I mean, he was in the league around that time and whatever. But yeah, so I just couldn't, so I just couldn't really do anything. But I just was giving them the updates and stuff, and then he told me afterwards, like, everyone, every one of them, everyone in the league was like rooting for me and stuff, and I just couldn't have been more like thankful for that. I've been like a respectable member, a well-known member in Elseworlds DC, and some people in other leagues, they know me pretty good. And yeah, but what so I faced these things, and I faced these things like pretty, pretty bad. So some of the tests, like they were talking about, I was like, huh. So I was like, okay. And then I had my cell phone with me, and I was looking this stuff up. So that was a funny part, even when I told them. So yeah. Anyways, yeah. So that league mate and myself, that former league mate and myself was like, we were like communicating. So that way I could, people, the guys on here would know about how I'm doing. And yeah, so I was like pretty sore and stuff. And yeah, I had like my drawing materials. I consider myself more of an artist than anything. I always love to draw, besides playing video games and watching movies and all that, or even like doing 3D modeling and stuff. And for games, I like to draw a lot. So I was doing these things and practicing, trying to kind of like do some some faces and stuff. And I was doing it from like a light, like a picture. And so yeah, I was drawing like that. See what I could do to kind of like make it into like a comic looking style, comic book art style. And yeah. But yeah, I just didn't know what to do with, from that. And then my father came around, to see me, to see how I'm doing. When I got out of the hospital and stuff, because that's one of the things that I needed, was to kind of like be discharged and stuff. And yeah, and to go see my pulmonologist, so where his office would be, instead, besides the hospital. And my father met him, and he was all like, he wanted to understand it thoroughly and stuff. So then he started to say something that, because for the plan for surgery, because that was like my best option. And I was like, you know what, yeah, I want to do it. I don't want to go through no chemo or anything like that. I want to do it, because I've seen what chemo does to people, and I didn't want to like go through that. So so yeah, that was good. But then I what my pulmonologist said was that the guy who he's gonna send us to is gonna be the one doing the surgery. Okay? And then the next thing you know, he starts to talk about, so he was like, so my father was asking him like, well, is this like, what is this? Is he, how well do you know him? How well do you trust him and stuff? And I don't know, the way how the pulmonologist looked, he just it looked like he was kind of a little unsure or something, but like from due to his expressions. But then I don't know. He answered like he was sure enough. So there was like a contradiction going on with that in a way. But yeah, my father was on top of everything with all of this, and then so he had like my the like a family doctor, and you know the family PCP, and know about it, and his wife, who's also a doctor in the medical field and stuff. She was communicating mostly, and the thing is, like, she couldn't even believe, she knew me like since small, she, when I was a kid and everything, and she couldn't believe, when she heard that, I had cancer. And then so she wanted to keep updated. She wanted, so she was making these, phone calls and looking at up the stuff and everything. She was doing all of that. And then and then I was I felt pretty thankful for that. I was thankful for being home and everything, and then when I got back on the game, I felt, I don't know, like I just couldn't really play the game pretty good like how I used to, and I was like, damn. I know the stuff, but it was like, it was sort of slightly like as a beginner, and I was like, wait a minute, I know how to play this game. I could play better than this, and then I had to kind of like calm myself and be like, okay, I got this. I could do this, And one of the things was that I had to make these decisions and stuff. I was a little thing, so I was like, well, let's go see what this guy got to say, because my hometown is in New York, so I live in one of the ghettos and over there, around Brownsville, and so but even though I grew up like from there, most of my life, and going to a different location, or I have my own attitude, I have my own perspective on things, and and I grew up a little different like from everybody else. So yeah. Anyways, so we went to go see this guy, and what my pulmonologist recommended, and and the thing is, he's telling me that he is not going to do the surgery. Somebody else is going to do the surgery. And the thing is, I'm like, really? And I couldn't help but feel like, wait, what the hell is this? What is this? Why, why am I wasting my time here? To basically meet my surgeon, and this guy tells me that he's not gonna do the surgery or anything like that. It was good of him to show us, like, the scan of my lung and what's going on, right? what is it that's looking so cancerous about it inside the lung and everything. And then I was like, what the hell? Even he said this with, even my mother was with me around, and she couldn't believe it. And then when she told, so we told my father, he was really upset. He was really upset. And yeah, so he was all like, "Nah, this is not happening. This is not the way." And I mean, I had like these records and stuff, that they had, and they so they were all like, thinking with that. So because that's when we got out of that building. That's when we told my dad, and he was really upset at that, and he was like, thinking about what would happen to me, and so I mean, I had like a feeling about how I was gonna be, but but they gave like a date of my surgery as it is. And the thing is, like, that's a wrong way to go. It is wrong, like, because the surgeon, you have to meet your surgeon before the surgery, and like, that's it. But nobody really, like, these guys was like telling me like, oh well, whatever. But I'm gonna let some guy do surgery on me, some guy who I didn't even meet. I mean, come on. No, that's unacceptable. I'm sorry, but that's not even happening. It's not even happening. And yeah, but anyways, it felt like a waste of my time and everything. And I mean, I was like, who the hell am I trust? Who's this guy? I don't know him. Whatever. Like, it was so wrong, so dead wrong. So anyways, after that, so I'm like two days after, like, I started getting a phone call around the time when I woke up. I was waking up and everything, and I mean, my parents was like downstairs, and they were basically like talking to each other about my situation and all of that. And then I was talking to this lady to make sure of things, whatever. So when so she was asking me a bunch of questions and stuff, and I didn't know like what to what to do, but she so I told her what happened, like, with the pulmonologist and the guy who he recommended that we should go see, and what the guy told me, that he's not going to perform the surgery. I told her all of that, and when she heard that, she was like, really? And and the thing is, like, she was like, if there was anything, like, maybe you should go, go somewhere else then, or something. To meet up with a surgeon, and for that surgeon to do the surgery. And I was like, yeah, you know what? That's a really good idea and everything. So, um, I so we had a really good talk. It was like, I believe it was like about an hour or two, and then I got out of my room, brushed my teeth, showered, all of that. Got went downstairs, and then and just talk to my parents. And you know what? Well, let's go to New York, because my father was he literally had that option open, and he's like real strict about that one. So yeah, so that's what he did. And so he was like, when I made my final decision to go to New York, and to the thing, because I don't know, like, I don't know how I was gonna be or how I was gonna feel, but I needed to to feel something. So I mean, anyways, so we booked the flight. We booked a flight to New York, and I needed to spend quite a few months over there. But yeah, and then my father he saw this guy. He was doing a lot of research, and he saw this guy, and like, his name is like Dr. Lazaro, and he's like one of the top surgeons. And yeah, so and he's a very nice guy. He's a real cool guy and everything. And it was really good, and I felt comfortable, when I met him and I talked to him and I told him about all this stuff. We sent him we gave him these files, all this, things that he needed. But the thing is, the hospital that I was in, he was asking for like this other file that but they're not letting that go. They didn't want to let it go. It was some sort of like a record or something that they were taking, that was taken by them with whatever. But they didn't want to like send it. They didn't want to think. They didn't want to do nothing like that. And then what happened was that I didn't know what to do. So I mean, my surgeon was like down, like literally down on them, because he wanted to know if they knew what they were doing. So I had to retake these tests all over again. And I was okay. I was like, you know what? Fine, let's do this. Because you just can't go ahead and do I mean, you need those files. You need all of that in order to do it, right? In order to get the surgery done and whatever. So you know what? I had no problem with anything, nothing like that or whatever. And then so they gave me like these so he gave me like these sponges and stuff so that way I can prepare for the surgery. And he also gave me like the I don't even know what the hell that damn thing is called. But this thing where you have to breathe in and out, like a breathing machine. So that way you could get the the lungs pumping and really good and everything. So it's to practice, to keep practicing with that, to do good and everything. So man, when I kept doing those breathing exercises, I was getting tired. I was getting a little frustrated because it wasn't fun for me. And, I mean, I was still coughing, still, but I wasn't, I wasn't like, I was just tired of that. But when they did their own thing, whatever, they got the info, and then after that, I mean, I had to like pack some stuff, pack some clothes, all of that, everything, you know. But in that other hospital, it was kind of funny because a lot of doctors and nurses really loved coming into my room, the room like what I mentioned earlier. Um, yeah, it was like my room was smelling a lot, real good. It was smelling fresh. It was like smelling a lot, the scent. It was like soap or something, it was so high and everything, or like Lysol or something that you spray around the room. But yeah. So they really like coming in because my room wasn't like smelling bad or anything like that, and it was like they even told me that like you're like the first patient we ever had that never stank up the play the room or something. I was like I'm like, well, I always like staying clean, you know. And it was like, oh well, that's a good thing. I was like, yeah. But anyways, like in New York, so anytime when I had to like shower and stuff, like I had to use those sponges. They were like disposable sponges. They had like this Bristol thing. They already had like this soapy, I don't know, it was like some soapy thing to clean your body. It was already in the pack as it is, and all you had to do was just scrub yourself off with it. So yeah, so they gave me that, and then next thing I dealt with, so I had to like pack, after that happened, I packed packed my stuff up and to go, like basically the important things. But I didn't really know, I mean, I told my friends on the game that okay, well, this is happening, all this stuff, and they were like, okay, well, wow, man, okay, good luck, But I wasn't really on Facebook, saying this, and yeah, but my league mates and stuff, they just like my league leader went to the to the league hall, and he started changing all the statues in the room into where my picture was. That's what he did. Like my statue. He just put it in every room and everything like that. They were like, every one of them was like rooting for me, and that was a good thing. I couldn't have been any more thankful than that. And I was like, yes, I appreciate it. I'm gonna hang in there. And so anyways, yeah, I try to be brave. I was a little like frightened about what what was going on when we went inside the place. But yeah, like I didn't know what was gonna happen or whatever. But I was like, what, whatever. I don't want this cancer crap in me, because it was at stage 1, so it was really early, and if it was at like maybe like stage 3 or stage 4, that would have been difficult. And yeah, so I mean, we just had, we were all, my parents were like this whole thing, and my father, like, I don't know, he was literally like kind of like tearing up. He was like kind of about to cry and whatever. I was like, don't cry, don't cry, and don't do that. And I was going inside the room, and so yeah, so I went inside this room, and I was like, it was like, okay, so the person was, he was like introducing me to these guys and stuff, and then I was like, yeah, and I was like, hey, and then there was this one person, like, I was gonna like shake hands, but she was like, I can't, I'm sorry, like, it was like, you know, so they were like real sanitizing there. They were everything. But I mean, when I was in the room, and then it was like, okay, well, you lie here, and then everything, and I was positioned. I positioned myself. I was feeling a little like. I was feeling a little frightened, I was like, oh man, and then they were like, I think yeah. So I remember the look in the room. It was like, it was a big room and had all this stuff, like, but it didn't look like it had too much. It just basically had the tools and all this stuff. So I mean, how it is when you're prepping for surgery. You have to be sanitized no matter what, and you have to be very clean and all that stuff. So no, no bacteria or anything. So anyways, yeah, so they were telling me to kind of like count backwards from 10 or something, or because they put on this thing on my face, and then so then I don't know, I started like dozing off. I started to like, my eyes started to close, and pretty slowly, and then I just knocked out. And then they were just basically performing the surgery and stuff, and then yeah, I don't really know like what happened, but I woke up, and I was in a room, cause yeah, so they woke me up, and I was in pain. I was in a lot of pain and stuff. I was not really prepared for that too much. I wasn't, and I was feeling like this pain on the like inside on my right chest, because that's where that's where the cancer was, inside that lung, the right side of the lung. The thing is that what they found interesting was that it was, a lung was collapsed. One part of the lung was collapsed, and I had a fractured rib, so. Oh man, like the bottom area of the of the rib, of my rib cage. So I didn't know. I didn't know anything about that. I was like, So anyways, yeah, I was in the room. I had a tube in me, and that one was kind of freaky. With to let out the liquids and stuff, and I was like so flat on my bed, like I just couldn't really move, and then they were like giving me all this stuff to have, Um, so, and I was trying to like breathe slowly. I was trying, but I was hyperventilating like so much. I was like, you know, I couldn't stop. I couldn't stop that. Because it was like a whole new experience for me, and I never experienced anything like that. I mean, I was experiencing shortness of breath for the first time, and I, that was not fun. I'll tell you that much. Um, and then what happened was that I went ahead and like the pain started to I was still having that pain, but it was like things were like easing up. I was trying to find my place and stuff. I was like, yeah. So anyways, I went, I was in the room and everything, and I saw my parents and stuff, and then and everything, they had me and all this stuff, and uh yeah, it was pretty crazy. They said I was gonna be in the hospital for like about 2 to 3 days and everything. So yeah, and so it was night, and I was in a private room. I didn't have anybody, but there was an extra bed, in the room, and nobody really was nobody was there. The room was like clean. It was it was pretty private for me. It was a big room, but it was good. Um, and then I mean, of course they had a TV. I was watching TV there, and it was really hard to sleep. I couldn't really sleep because every time it was like there were times like doctors and nurses was coming in to check on me and stuff, and they were monitoring my heart rate, everything. They were doing all that stuff. Uh, so I mean, that first day, that I mean, I couldn't move. I really couldn't, and I needed some help. But I couldn't like walk around. I couldn't do any of that. I was so I was like, I felt like I was so out of shape, like nothing. Oh man, but yeah, I mean, when you have surgery, it is pretty hard to move around, and I needed somebody. All the thing is, the nurses in there. I mean, they weren't really all that helpful, you know. But yeah, so I was real out of it. I I mean, that morning they brought they brought some breakfast for me, and I couldn't eat it. I just couldn't. And I felt so down and everything. They had me like get out of the bed and then move to the chair right next to it. And oh man. And so I was just sitting there with the food right in front of me, and I did not even take not one bite, not nothing like that. I was just thinking about what happened. I I was quite a bit in pain. But yeah, it seemed like I was staring into space for a few out for like about an hour or two. I met up with one of the surgeons and stuff. He was a pretty cool. The other surgeon that was in the room, he was a pretty cool guy and stuff. You know, uh, and my surgeon, Dr. Lazaro, he came in, and um, yeah. So I mean, the thing is, like, one of the things he did say was that he would treat me like I was his own son, and that was, I mean, my father, he felt comfortable when he said that. So he was like, he just left him, left me, in his hands and stuff like that, and everything. So to take good care of me with that and all that stuff. So he visited me. The other surgeon guy, I can't remember his name exactly, but he also visited me, and just to see how I was doing, and so yeah, but I was like, I don't know exactly how to feel or what. But the thing is, like, with the nurses, is like they were like pretty forceful or something. I don't know what their deal was. I didn't even know. But I mean, I could have walked a little bit from things. So I was kind of like I started to gradually getting used to that. Then the next thing this person started to like make up the bed, and I was just in there. I was like just sitting down, and I couldn't really talk all that much because of the pain and stuff. And if I were to say something, that was it. But the thing that they, they, the painkillers that they were giving me, it was like, the injection, not, well, taking it orally didn't work for me, but, doing the injection, that was working for me. That was working for me tremendously because it was a lot quicker and everything. And but yeah, I remember taking one or two little steps. That was it. I felt so out of breath. It was not even funny. It was, I tried moving a little bit, and it was real painful. I didn't know. I just didn't know what to do or anything like that. But it was, I don't know. I felt real weird. I felt real weird about it. And then I try to like eat something. I try to eat the breakfast. I try to eat the breakfast that was on the tray, and everything. And it was kind of like, oh man, I just wanted to be left alone or something, And yeah, I just couldn't stand it. I just couldn't really deal with it at first, and then like, I don't know. Then, next thing you know, my parents started coming and everything, and they tried helping me, with everything, and the nurse, I mean, so then I had the tube on, inside me for like about a day, because the surgery I had was robotic surgery, and yeah. So I mean, if I was, so I was like cut up here and there, and and they took out the bottom lobe of the lung and the middle part, so I'm left with the top part of the lung on the I'm left with the top part of the lung on my right side, the right side of my chest. So yeah, anyways, I started to get to gradually get there, like slowly but surely. And it was I still couldn't really walk. I mean, and, when the tube, so the next day they took out the tube, and then it was like they were telling me like, okay, well I have to, they were gonna like take out the tube, and there was this nurse, right? That was basically supposed to be the one handling that job, and she just did not want to work. She just did not. She was all up on her cell phone, up in the computer, just looking up at emails and all that crap. Next thing you know, I'm seeing her on her cell phone, like talking to somebody, hanging out by a thing, and then I'm like hearing some patient screaming and in pain and agony and all that crap, a couple rooms down from me, and it was, I was, oh man, I wanted to yell at this person. The other nurse that was in there, she had an attitude, but then she started to, gradually, like get to know me a lot better and to see how I am and all that stuff. And, yeah. But, yeah, I mean, it was like pretty terrible. It was real terrible. Man, I was a little pissed off when I was able to kind of like move in a way. But yeah, oh man. So this nurse and stuff like that was supposed to pull out my tube. I don't know exactly what she was, but I don't know. I don't know what was her deal anyways, but she started to talk to me. She's trying to talk to me nicely, but you could see like that wasn't the case, like she still had an attitude. She was like, oh, breathe slowly, you gotta breathe slowly, come on, and everything like that, and everything, and so I was like, look, I'm trying to, because she just kept doing that. I'm just rolling my eyes. I'm like, oh my God, I hear you, but I'm trying, and then, all of a sudden, like, and like my mother was right there, and she started seeing what, these guys, what these nurses was doing and everything, because they were like taking out all this stuff. So then all of a sudden, like, she started putting, she took out the tube and she bandaged me up real quick, and then I was like, I saw it, I saw what was up, and yeah, then the next thing you know, she just put her hand on my shoulder, and she was kind of like shaking my my right shoulder and stuff, and I was like, oh my God, stop. I was so aggravated, but at the same time I was alert, and yeah, and yeah. So next thing you know, she started like getting out of the room, and then my mother and that other nurse, like, it was like, it was like, all right, so, well, stop, what are you doing, all that stuff. So she saw what was happening. She of course, she's my mother, she knows me pretty good. But then I started to so she could see that I was literally trying to stop breathing hard, stop, but it is quite a challenge to do this. And so yeah, I was doing like breathing exercises after that and all that stuff. While I was doing that, my breathing exercise, um, I mean, they say that it was going to be real painful and stuff, but like I didn't really feel anything. I didn't feel any pain, none whatsoever. I just happened to take it, which was, you know, which was pretty funny because I was able to withstand like those kind of pain, and like amazingly, what the nurse was saying, that it's like I have a high tolerance for it. I mean, I was feeling it, but I could take it, you know, with pain like that. So what was interesting to me was I learned something about myself with that I didn't even know. I mean, some patients have gone through stuff like that, and they experience they don't really have that much of a high level for pain like that. And yeah. So I was so I don't know, I don't know, I kind of felt a little fortunate with that. But I was still breathing hard, and yeah. So yeah, the only thing is, like, sometimes the pain will come back up from time to time. But yeah. Anyways, they 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 gave, so my so the nurse started to like kind of like calm down and everything, the other nurse, um and she started to become more understanding. I don't know if it had anything to do with that. Okay, well, my mother is all, is, in the also in the medical field. I don't know if it had anything to do with that. She's an RN. I don't know. I don't know if that was the case, but I think she started to like kind of like get back to work, and then like I remember hearing something like that her and the other nurse was like literally going at it, like literally fighting. And yeah, so it was like, okay, so that other nurse was getting to work, but the other one didn't, and she was just basically wasting time and all of that crap. And then it was real crazy. Then my father started to come and everything, and whatever. But that other nurse was saying that I gotta move around. I gotta move around, because if you don't, it would be a huge problem. So I mean, I was able to have like my breakfast, my lunch, my dinner, and then the next thing you know, the day after that, I was good, but the amount of walking I could have done was going, back and forth to the bathroom. The only thing I could have done was going to actually go to the bathroom and stuff, and then come back out, and that was all the walking I could have done. But the nurse believed I could have done more, and then my mother helped me out with that, and she so she was like walking me around and stuff. So, I mean, the nurse did at first, because of course I needed help. I didn't really have anybody, so she helped me out and made me walk around that floor, and then like basically like outside the room to the main hallway, going down through the rooms, and then going back into my room, and that was it. So I needed to get some of that in there, and yeah, that was good. And and then my mother started to to help me out with that. Um, and then so I went to do like those walking exercises like about maybe like 2 to 3 times if anything. And yeah, so that when that next day happened, it was kind of funny because there was this old man, right? It was this old man, and I mean he was having like the heart surgery and all that because I could see like there was a kind of a scar, like a stitch on his chest, and his chest was like kind of stitched up right there, and 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 he was kind of like, I don't know, like a neighbor or something, and it was real funny because we kind of like anytime because he's the one who's doing his walking exercises, you know in like around like breakfast time and and lunchtime and dinner and stuff. And then it was so funny. It was real funny because we started looking at each other. We started waving at each other like, "Hey man, how's it going?" And so that one was pretty funny though. And I was like, "Oh man, he's doing way better than me." He's doing way better than me. And yeah, so I don't know, like my father's side, my father's elder brother, his wife, and my aunt, one of my my aunt and uncles and stuff like that. They came, and it was pretty thing and stuff. And then my cousins started to come. My brother didn't, even though he wanted to, but he had that whole thing with hospitals and stuff. Yeah, my aunts, my like the extended family and stuff. My aunt, and like who's been like, she's like a second mother to me, anyways, because her son is basically my eldest god brother. And yeah, so so I mean she visit me to see how I'm doing and stuff. When my god brother heard the news, he couldn't even believe that, like I had lung cancer and stuff. But yeah, my other god brother, who's one of the cousins of my elder god brother, he he couldn't do it yet. He couldn't do it, but his mother came by and visit me and stuff. And yeah, it was quite like a big room. And we were talking, and oh my god, my aunts, my father's my father's eldest brother, his wife, his wife was like making talks with me. He was like she was like making talks with me and stuff and everything. But with all that, like I just couldn't keep up. Usually like I'm able to like keep up with making talks to another person. And when I say this, the word talks, it's like we try to like kid around. We try like telling each other a lot of crap, all those type of things. So that's what we do. But I was not really much in the mood for that. I couldn't deal with it. Yeah, so I was like, oh boy, I mean, I couldn't really deal with none of that. So it was a little too crowded, but I mean, I had to get my walking done. Um, and it was kind of hard for my cousin, that he was thing. So I mean, all this stuff. I mean, it just it happened and everything. Um, but yeah, it it was so thinged and mhm. I mean, you know, my god brother's sister, my the other one, my other god brother's sister, she even came back. I mean, she was the one who drove me, and everybody else to the hospital and stuff, so I could get the IVs and all that crap. But I mean, the first time, like I thought I was gonna go and get the surgery as soon as the thing, but it turns out that I had to do it another day because, the other thing was that this other surgery was being taken. So I mean, my doctor couldn't do it. So I was like, my father was disappointed that day and whatever. But we were like, okay, well, whatever, fine. But yeah. So anyways, going back to what I was talking about, this day was it was yeah I told I was going around, making my rounds and stuff, and then I was gradually getting it, and I could have done like maybe like mostly like 2 rounds out of like how big that place is, and back and forth and everything. But I needed like a break. I needed some time for myself. So anyways, yeah, so I came back, and then dinner was there for me, but I didn't enjoy the dinner. It was bad. It was bad food. But I had kind of to force myself to eat a little bit for that energy, for all of that. And then so anyways, yeah. So I had to get going. Um, like the next day and all that. I think it was like a Sunday or a Monday, because I know all this thing happened on the weekend, and yeah, so yeah, I think I came home. Yeah, I came home. I came back home around a Sunday or a Monday, but I definitely couldn't travel back to where I currently am. I couldn't really do any of that. And that would have been bad if I was to travel up in the air like that to come back over to my current location. But yeah, so I mean, everything was all right, and I couldn't make, I mean, I had to take, of course, I had to go take an elevator to go back to the to get out of the hospital, and he so they got a wheelchair for me. The nurse got a wheelchair for me, and it was like, okay, well, it was the second time, like, when we came out of there. The other nurse, she really liked me a lot. She was like, yeah, um, I went by, I mean, I got dressed, I was everything, and but then there was this other guy who came in, so it was like I basically spent like maybe like a day being in the room with him, because he came in and he was cool to talk to and stuff. But everybody couldn't really believe that the people that came to see me was like real crowded like that. So um, yeah, and the thing is with my father's elder brother, he doesn't really go anywhere all that much. He has his own health problems, but he came to actually see me and stuff. But I don't know what impression I had over my own family like that. Even like ones that can't really travel all that much to go far places like that, from where he's living and everything. That I don't know. Um, I never was able to. But yeah. Anyways, I had like this thing, and then I had to take a taxi home, and all the way from Manhattan and stuff. And that's where I was. So yeah, I was. I walked. Like as soon as I reached out, like outside the entrance and stuff, I walked, and then I took easy steps, and I mean, the thing is, like, the pain, the pain wasn't bad as the first day. It was pretty good, but I was still feeling like those those cut pains and stuff, everything. So, I mean, so I got home. It took like, well, just went home, and then that was it. I started to like go around, like walk around, well, as soon as I came home, I took a little rest, and then I started to walk around the house and go upstairs and downstairs like a lot. So I started making like a combination of that, but every time that I kept going up the stairs, I felt like I wanted to collapse. I felt like I felt like I was gonna fall back, and that wasn't good. I mean, there was like some work done in that house, so it was kind of like, okay, the steps are now like hard floors. It used to be like, it used to have like carpet covering. So I mean, we had done some work with those steps to like brighten up the floors and everything. So yeah, I mean, if it was anything, I could have stand, if I could have stand that, but it's like, I don't know, like sometimes like the hard floors could be really slippery, even like if you had socks on and everything, and you don't have like that extra handle, right? Even if you don't have those extra handles and stuff, and like maybe like you may have like towels hanging right next to like this part that's keeping up the handle and stuff. I mean, yeah, by the ledge there, like I had like about like a step or two to go up, and then that was it. There was nothing to hang on to, and yeah, I felt like I was gonna slip and fall back, and I mean, yeah, that kind of does. If like anytime when I visit New York, that's what happens. I mean, my surgery was done in April of 2016, and yeah, so I mean, I had to like see the doctor from time to time, quite a bit actually, and then had to walk. I had to do all of that stuff. But yeah, I better myself, um, and everything. That's what I did. But I was still hyperventilating. I was still doing that. I was playing video games, and I was playing this game specifically, and yeah, it was crazy. So I mean, I became a cancer survivor, um, and yeah, I could get back the cancer, but that's why I have to keep doing these checkups, is to do that. Um, so yeah, it does take like a certain amount of months and stuff, and just to like get back in the gear with whatever, like to for you not to feel like this, not to be like this. But I always felt like there was this pull on that area where I got the surgery, and yeah, that's not comfortable. And it was kind of hard to twist and turn, and also raise up my arms and everything. It was hard to do that, but I had to try to do something. So yeah, that was basically like my experience and stuff with having to have surgery, lung cancer surgery. And yeah, I wasn't even enjoying it. But yeah, I stopped, afterwards. Like I stopped like almost everything that I used to do. Like I stopped drawing, I stopped doing all this crap. I was like, doubting myself, everything with about my personal life. I was going through this state where, of what I had to deal with and stuff, and my parents was like telling me like maybe I should go and into one of those groups that talk about this type of stuff and everything like that. I was like, no, 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 it's all right. You know what? I'll just go ahead and deal with it myself and whatever. I was like, are you sure? I'll pay. I was like, no, 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 no. That's no. So I mean, yeah, I was down and everything. Like I felt like I lost some things and whatever. Like So I haven't drawn a lot. I played video games just to get my mind off of things, and all the negative stuff. That's why I was playing video games. Um, I was so I mean I felt like that was like the only thing. But like if I wasn't doing that, I had like that negative reaction. Sometimes I do while I'm playing the video game, but yeah, I'm just right there. And yeah, it was crazy. It was just one of those things. But I couldn't make a move, just to do anything for myself. Really, I just couldn't really do much of that. So I mean, at this point, that's what I'm doing. You know, that's what I'm doing. I'm getting back in a gear with my stuff. That's what I'm paying attention to. So yeah, and that's basically like my experience when it came to that surgery. Um, but yeah, like one time, another. I'm sorry to go into all this other stuff, but it's all part of the story. Of 2016 and everything about what I had faced. But like I was gradually getting better. I was able to walk, do all of that stuff, go up the stairs, go down. But yeah, I was feeling a little hyperventilated. But yeah, it was one of those things where I was I could have gone out, I could have walked, I could have done all that stuff. But anyways, like I went to, before I was going to, like I had to like take the flight back the next day, you know, with to go back to my current location. I before that I visited, my elder god brother's parents, because they're second parents to me and everything, and they knew me since young, like 6 7 years old. That's how they know me, so we knew each other for a long time, and them and their family have become, extended family, my extended family and everything. So we all grew up with each other, everything like that. But yeah, so I always go ahead and I visit them. Even like I have to, usually I go before. So anyways, I don't know, like, okay, so I was home alone, by myself, and I made the decision. So I went to, this was like sometime in November of 2016, and so I went, and what happened was that I bought a Metro card. I took a bus, and then I got out of the bus from this other location, and then all of a sudden, what happened was that there was this lady in front of me. I don't know. I don't know. She was having like this, I think she was having like a bad day or something like that, but she stopped right in front of me and everything, and I was literally behind her. She's turned around. She did not look at me, and I had to step to the side, but everybody was going forward. No one was going backward or anything like that. So yeah, so we got out of this this bus stop location and all that crap, and I stepped to the side, and I didn't see this, but there was some pothole or some like that, somewhere, and I almost fell. So I lost my balance and everything, but I almost fell, and I kept myself balanced up. Like I had that strength within me. So the next thing you know, something happened to my foot. I felt like, I thought it was like a pain that I could walk off, and then what happened was that I walked all the way, and I walked all the way over there, and I was feeling the pain, but not as much because I had my sneakers on, right? So when I reached the house, I took off my shoe. I took a couple steps up to go, to go inside and everything, and then, it was really painful. It was really, really painful. I don't know. I didn't like that experience at all. I mean, this one right here was another setback in my life. Oh man, they were surprised to see me. That we all talked, we all whatever. But it was good gesture, but still. I was in a lot of pain and everything, and I couldn't make it back. So, I called my father, told him where I am, everything like that. I told him what happened, and I don't know, because, I was still feeling this pain. I don't know why. And then, so he came to pick me up, and we came home. I felt, I was still in a lot of pain. And even if I took any pills or something just to get rid of that pain, I don't know, like Tylenol or something, Advil or Tylenol or something like that, it was just weird. It was. I don't think it would have been. I don't think I would have been able to withstand. The pain would have subsided anyways. So my father wanted. He saw. He was like, okay, take off the socks. Let's see what's up. So I did, and then my foot was kind of like black and bluish, and everything. And oh wow. I did not like that. Not one bit, man. I did not like that. So anyways, I started to I tried to I don't know, one little step, that was it. But I don't know, I got so pissed off. It wasn't even funny, man. I was so pissed off at that lady, because of what happened. She couldn't step to the side. I don't even know why. But I'm like, what? Next time I do something like that, I'm just gonna, if a person does that, I'm not gonna step to the side. I want them to step to the side. Because I've always been courteous and everything. And the thing is, so I'm not doing that anymore. But the funny thing is, somehow I got into contact with my fourth grade teacher. I got into contact with him, and I don't know, somehow that just brighten up my day with that, because it's been a long time and everything, and whatever. I mean, he was at the school for a long time, the elementary school for a long time, and then a lot of things started to happen. He eventually, he became principal of the school, and then he moved on, and everything like that. So yeah, that was really cool. He's on Facebook, and we were talking and stuff, and yeah, so yeah, he's somewhere else. He's teaching there and everything. I don't know the exact location where he is right now, but I don't have the thing. I don't have my computer in front of me right now, or else I'll be able to say where he is. But yeah. Anyways, yeah, it was really good seeing him. But my father, he wanted to see, to take me to some foot, some foot doctor to get this thing rubbed out or whatever, right? And this bruising pain was right between my small toe and my ankle. It was between there. So I was like, you know what? No, I'm not doing that. I'm not doing that. So I took the flight back to my current location where I am right now, and basically where I live right now, and so that wasn't fun. That was not fun at all. To be on my to be in my feet like that, to go pass through security in the airport, and keep experiencing that sort of pain, and to travel back and all that crap. Oh man, it wasn't fun at all. And then yeah, I just had like this thing on me where, like I had to go see like a foot doctor, and so I mean my mother picked me up from the airport and all that stuff. So the next day or so, like, I wanted to go see a foot doctor and everything. We took X-rays, and what happened was that my my foot doctor told me that yeah, your fifth metatarsal is damaged, and it's broken, but it's hanging by a thread in two places. And I was like, holy crap. So it's like, okay, well, I needed to walk, so I couldn't like walk, so I just take, not be on my foot. I had to keep off the foot and everything. So I was like, okay. So then, I mean, how I had where my PlayStation was set up. I mean, I have like 2 living rooms and stuff. So I had to move my my PlayStation downstairs, and down in the downstairs living room, and yeah, I had to do that, and it was all good. I had to, so I had to like kind of like almost move everything, downstairs, take the master bedroom and everything to sleep and all that. So yeah, so I was downstairs for a while, until when that happened, and then everything was all good, and then so I don't know, like when that happened, I felt like I wanted like dairy products, like a lot of dairy products. I had like, I had the need for it though, for some reason, and I just, I kept having that, and so yeah, I kept having that, and I went through that other, that whole thing where I just had to like keep seeing my doctor. Now I had like these those like what was it, those like the walking sticks or something, like the ones that you put under your arm and everything. I couldn't deal with that. I had a lot of trouble. I had a lot of trouble balancing myself with that. Yeah, so I had to get a wheelchair. So yeah, I was playing this game, and I was trying to of course I was making progress, and then yeah, I mean, I had to do all those other things. Oh boy. Anyways, what happened after that? Like, I mean, I was gradually improving, and then I went to like when I was able to walk real good and all that stuff, I had to, like go to this place to like get it exercise, exercise it, so I could, to get back motivated into walking again. And it wasn't really, it was good. It was fun. Um, I mean, I also had a sciatic problem, but but I'm still able to walk. You know, so yeah, my left on the left foot, the fifth metatarsal area. That was one that was one crazy thing. And then I so I had another problem. All right, so this was in December 2016. So my father comes visit me and everything. Everything was all good, whatever. And then I don't know, but for some reason I started getting like this pain and stuff. Now this pain was coming from around like my diaphragm or something like that. And and this was in December 2016. And I had to be sent to the ER. Okay. So they ran some tests and all that crap. Of course. And they said that I had a gallstone that's as big as a golf ball. And I was admitted into a room again. It wasn't the same room, but I was hoping that it would have been, but it was whatever. And what happened was that this sort of thing happened that that I had to like get another surgery done. So I was like, oh my god. So they were doing some things, like in the room. I was falling asleep because I didn't get any sleep. And this thing happened like, I don't know, like 12, like around 11, 12 o'clock in the, and yeah. This thing happened around that time that I was feeling that pain, and it woke my parents up, and my league mates were wondering what was happening because it was literally hearing me through the mic, like this pain, this other pain, and I was like, oh man, and it was like, okay, what, time to be, things, time to go through the hospital and stuff, trying to get checked out. And yep, this was like so close to Christmas, and I had this surgery done. So like this surgeon, he was like a different guy. He was like a younger dude, right? And cool guy too. He's good at making jokes. He's whatever. So he goes ahead and you know he goes ahead and perform the surgery and all of that. My parents would stay with me in the hospital. I was in there for like a couple days, and like around the day when it did happen, I was out. Of course, that same ass routine and all that. But yeah, I'm sorry. My mind is going through a lot of things. Oh man. But yeah. Anyways, I mean, when I was in the room, I'm sorry. Let me step back for a little bit. When I got into when I got a room and all that, a lady came, a nurse came in, and she was asking me a bunch of questions and all that stuff and everything, right? So, anyways, she, when I don't know, like the amount of questions she was asking me, I was like falling asleep, but she kept flicking my hand and all that crap, just to wake me up, and I'm like, oh my god, I just feel like doing the same thing to her. I don't know, I kind of felt like I wanted to smack her hand away or something and let me go to sleep, but yeah, I mean, of course I had to like get these blood tests done and everything like that, especially like I had to get like blood taken out, not from the I think what the artery, not from the vein, but from the artery itself. So that's a hard area. That's pretty tough to get blood from there. So this guy, I don't know how this guy does his job, but this guy, like every time I saw him, I was pissed. I was pissed off. I was like, man, this guy doesn't know what the hell he's doing. I don't know who the hell hired him. So he's going through my wrist. Okay, he goes on my right wrist, trying to draw out blood, trying to find the artery right there. He can't find it, right? Nothing was being taken out. He kind of swirled around a little bit. Nothing. Nothing. Not one drop of blood. Like that was going inside. Nothing was being. No blood was being drawn out. I mean. So, anyways, he went to the left side. Okay. Then he starts to take the same needle. He does not bother cleaning that needle at all or whatever it is. He starts doing my left side. He's swirling around. He hits something, and I felt like something in my wrist was slit. And I was like, oh my god, man! I was like so pissed. I was so angry at him and whatever. I'm like, and everything. And I'm like, oh my god, I want this man fired. I want this idiot fired, man. Who the hell hired him? So, I was literally about to curse the holy hell out of him and everything. But then, this other guy started coming, right? And so I don't know. He wanted to know why I went somewhere. Like he wanted to ask me a few questions, like why did I go to this other location to do the lung surgery and everything like that. And my mother was like, you know what? I don't want to get into this. And whatever, it's like, oh, okay, all right, that's fine, and stuff like that. So he left the room, right? And I'm here thinking to myself, okay, okay, first of all, it, it shouldn't, my health, it shouldn't matter where, I get treated. It shouldn't even matter. My health is not like a freaking game. It's not like a competition. Okay. And second off, like, why is he even asking that kind of question? That's a little too personal. That. I mean, look, I look, I had my reasons, right? And I already said it earlier in this broadcast, and all of that crap. So it was like, why am I dealing? Like, no one's health should be a competition. You have hospitals everywhere, so like, why even bother asking a question like that? No one should be asking a question like that. It was like, okay, well, it's nice to see you, great to see you, something like that, but not to be ridiculous with asking a dumbass question like that, to say, oh, like, my hospital is better than yours. Come on. My hospital is better than your hospital. It doesn't. No, that's stupid. Like, it's not a freaking competition, and it shouldn't be a competition with hospitals all over the place. In this world, it shouldn't be. So that was like a wrong question and stuff. But man, real crazy. So, anyways, I mean. Yeah. Anyways, this other guy starts coming in. Like, he was like an elder, like, an elder guy. He brings in like this machine or something. Like to pick up something, to pick up like where the artery is located, And then yeah. So he went on my arm. Like, he went he went around like my arm, like somewhere around my right arm, somewhere like kind of like around my bicep or something. And he pointed at this I don't know, this thing that was, hooked up to the machine. He, like, it was kind of like a stylus or something in a way. So I can't remember what the name of that machine is called, but I mean, if there was anything, that should definitely be used. If you have to be taking blood out from the artery itself. But anyways, he heard like the beeping. That so he picked up the artery, and then he started to get it. And then he had to like kind of move it a little bit, and then that was it. Boom, blood started drawing out, and that just took him like, like maybe like 3 to 5 seconds, give or take. And I was like, man, you're way better. All right, I was like, oh, thank you. But I don't know. I don't know if that guy, that guy who I mentioned, like, I don't know if he's fired or anything. But yeah. Anyways, I had this thing. I dealt with this crap. So So right now I don't have a gallbladder anymore. I'm living without one. And yeah. So yeah, I mean, we cracked, me and that surgeon, cracked a few jokes here and there, but that was about it, and yeah, 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 he was cool and everything. I saw him, and I mean, every time when I saw him, like I just kept apologizing because he hurt his wrist while performing surgery on me and stuff. Yeah, that was kind of funny. But anyways, I didn't want to take up too much time, so I'm just gonna cut this broadcast off right now, man. Because it's been too long trying to explain in full detail about my experience about with me being a cancer survivor, and me going through like with my setbacks and going through like two surgeries and all that crap. So yeah. Anyways, I'm out.